The decision to postpone the game was made to ensure the health and safety of the players, coaches, and game day personnel. The Titans facility will remain closed, and the team will continue to have no in-person activities until further notice. What is your reaction to the fact that this game has been postponed to not just Monday at this point, but later in the season?
Well, thanks for having me. I think it's a very good idea, honestly. I was very skeptical that the NFL could get a season going amidst a pandemic that hasn't really been curbed yet. We've seen 200,000 people die from COVID-19, millions more infected. At the hospital that I'm at, I've operated on patients who are COVID-19 positive, taking care of patients with neurosurgical disease burden with COVID-19. So it's still here. It's very real. As you've seen today, the President of the United States and the First Lady infected with COVID. So it's happening. It's permeated all parts of our culture and now into sports and football, where you can't really have a bubble. And now you've exposed a lot of these players, personnel, their team, their family members to this very infectious virus. It's very challenging to think that the season can go on with any more disruptions like this.
Myron, first of all, it's an honor and a privilege to finally meet you and talk to you, my brother. Very, very proud of you. Thank you for all that you've been doing. Let me ask you this. Your thoughts on what the NFL has been doing to address this whole pandemic. You've been watching them take place. The NFL draft was was virtual rather. Obviously, there was no preseason game. I imagine you would be supportive of that, but there have been those who have questioned whether or not they've done all they could in order to move this thing forward and to find a way to salvage this regular season and beyond. Your thoughts about how the NFL has handled things overall over the last several months?
Well, it's a pleasure to meet you as well. And I think that the NFL has fallen short, honestly. I think their priority is putting the product on the field, right? They have a consumer. They want to meet a demand that everyone is yearning for football. They want to get this product out as much as possible. I just feel that there's more that can be done. And I yearn that these players continue to try to protect themselves and their family's health, because that's the premium at this point.
Dr. Rolle, I find the following argument persuasive, and I'd like to get your opinion on it. Because what you're describing is really an issue of degree, not kind, so to speak. Like, if they enforced the actual protocols better, if you could trust the league more, et cetera, then maybe it could work. But originally, I was initially very skeptical that the NFL would ever complete the season, given the technology, call it, at the time, right? No vaccine, certainly no scaled up vaccination, and the testing was hard to get your hands on, and it was needed in certain areas. You couldn't ethically, I don't think, take so many thousands of tests away from where it was vitally needed in places that weren't just diversions. And yet antigen tests, where apparently there is no false negative, right? And you might get a false positive, which just means great, take the other test and better to be safe than sorry, but not false negative. So if you see they're negative, it means they don't have it. Given the availability and accessibility of antigen tests, how you get the results right away, and that allows contact tracing to happen much more quickly. Maybe an organized league like the NFL is safer than society at large, for lack of a better term, right? Because they're being constantly tested, and therefore, as a vector for the disease, maybe they would affect each other, but maybe not a vector for the rest of society, meaning it's ethically responsible to play NFL football, provided they follow the protocols, and maybe there's a good chance they actually complete the season. I find that argument persuasive. What are your thoughts?
Well, I think that's part of the story. And if they can get that done and get it done well, efficiently, and effectively, then certainly I think you have a case where the NFL can resume safely for not only the players, but also the staff and the family members. But I think you add in different variables. When you have teams traveling, you don't have people who have the same sort of COVID-19 status as you. You don't know the contacts you're making when you're in a hotel, a plane, a bus, transporting from the hotel to the facility or to the stadium. So that just adds these new degrees of risk that we're just not sure of. Add on the fact that we're walking into flu season, and we're not sure what the co-infection of flu and COVID-19 does to a certain protoplasm. We're just not sure of it yet. What we do know is that COVID-19 does not discriminate. We thought it just hit predominantly Black, brown, poor people, and then very old and very comorbid sick people at baseline. But AJ Terrell succumbing to his issues, and then a Division II football player dying from COVID-19 complications, it permeates everywhere, and it's real. And I hope that we take it seriously. I hope the NFL uses epidemiologists, independent studiers, researchers, people from outside the league to really try to come back to the core of figuring out how do we place a premium on these players, on their health, because that is at the utmost stake right now.
Absolutely. Health always the top priority. We do know as of yesterday, the NFL also has released a new set of protocols, even furthering their safety guidelines for those teams who are experiencing some type of an active outbreak. So, Dr. Rolle, thank you so much for your time. Thank you for your expertise, and we appreciate having you here on First Take.
Thanks for watching ESPN on YouTube. For live streaming sports and premium content, subscribe to ESPN+.